know true life being. We only know true life being. This is a God dream. This is a God dream. Yeah. Every day. I'm just trying to keep my faith, but I'm looking for more. Somewhere I can feel safe.
All right. This is Health Insurance Discovery, Covered and Confident About It. I'm Shanae Starnes, and I am a passionate health insurance agent with the mission to provide accessible healthcare and financial literacy every day. And the question is, how can I serve you? This is something that has been within my wheelhouse for the last several years. And more as I work with people, I've come to learn that this information is just not it's not that it's not accessible, but more and more people need a clearer understanding. So let's take this ride today and let's talk about, like, what do I actually do? So what is it that I do? Why am I so passionate about what I do, right? And let's start off by me sharing with you that I offer personalized health insurance solutions that bridge the gap between your unique lifestyle. Everyone has a unique lifestyle, the way they're living and what their needs are. Also, you may have some business needs. You have a business and don't have health care, and you're just looking for overall comprehensive coverage. What does comprehensive mean? Comprehensive means that it's major medical, and I'll go through what that's going to look like here in a little bit, right? So today I want to help you understand how to make the most of your health insurance coverage. And I can't go forward without actually sharing about this accessible healthcare that we're going to talk about. It's been termed many terms. Some people know it as Obamacare. Some people know it as ACA, marketplace.gov, healthcare.gov. But what I do is I help people to find great insurance. And when you get it, it's something to celebrate. It makes me feel great that I'm able to partner with someone that needs it, and they're able to use it, and they can stay healthy, get the medications they need, get the services that they need. So I can help you out with that as well. Let me use the term real quick, colloquial, because when I say the term Obamacare, many people recognize that term. But if I use the term ACA or Affordable Care Act, or if I say marketplace.gov or healthcare.gov, and there's some other terms that you may hear, people are like, I don't know, they don't understand. But just to give you a background, colloquial are terms that people adopt. It's a familiar conversation amongst people using those words, and it's not formal and it's not literary, right? So an example would be when we use the word y'all, or we gonna, we wanna. Those type of phrases are called colloquial. So if you hear the term Obamacare, just know that it's a term that is embraced, and a lot of people know it. You know why? Because he created and signed into law something huge that has never been done. And I have been blessed to partake in the usage of Obamacare. So if you hear me use these different terms, it's about me sharing the education with you so that you can stay along with me, right? So comprehensive is really major medical coverage. And again, I'll break down to you what is major medical coverage. This is what I help people do. I help people get enrolled in health plans so that they can get one of these right here. And this is your health card. This is the card that you may have to take in should you have to go to the hospital, you have to go to urgent care, or you just have a visit to your doctor. This is what gives you access to care. And I just use a generic version because there are different companies out here that will have their name up in this right-hand corner or wherever they may put it on the card. But this is what I help people do. I help people get connected, right? And who does this actually impact? Well, let's bring some real people into the fold. Let's talk about Patricia. Patricia, she's considered to be like an early retiree. She retired early, and a lot of people are not retiring at 65, but in her case, she's retired at age 60, and she's facing the challenges of securing the health care until she becomes eligible for Medicare at age 65. So she's looking for comprehensive health coverage, much like what she had when she was on the job. So she's looking for an ACA coverage plan. Again, that's also called Obamacare, Affordable Care. She's looking for that plan that's going to align with her retirement budget, and it ensures that she's covered for any unexpected medical needs. So there are plenty of Patricias out there, I know firsthand, because these clients are looking to retire for one, and in doing that, they have nowhere to go. They don't have any health coverage, and a lot of people are out there without it. So I wanted to paint a picture of a profile of a person that I actually have. I have these types of customers covered because it's accessible to them, and they were able to find me, and I was able to educate them, and now they are covered. And let's look at Janice. Janice, she's considered to be like a 1099 contractor. She's an entrepreneur. She may be someone that's like a gig worker. She could be a consultant, someone that is trying to contract with other companies to come in and do business with them, right? So as a 1099 contractor, Janice seeks an ACA coverage plan that not only caters to the fluctuating income, but also provides that comprehensive medical support that she's looking for. So when I run into my small business owners, a lot of 1099 contractors that come in, or even people that file as a Schedule C worker on their taxes, I help them. We discuss income to help them understand where they qualify. And so this profile is out there. They're in need of coverage, and Affordable Care Act could be that coverage that they could obtain. Now let's look at James. James, he's actually in that transition of careers. He's been working in corporate America, and he's now going into his passion. There's quite a few of us that have experienced that, want to experience it, but you're kind of stuck because you're not sure how you're going to keep up with healthcare. So we stay seated where we are because we just don't know. So he wants to jump into entrepreneurship. So as he makes this transition, he's aware that his health insurance needs are changing as well. So in this instance, James may have a chronic condition, such as, let's say, it could be diabetes, it can be high blood pressure. He may already have a chronic condition. He's been working in corporate America, but he wants to go into entrepreneurship. But he knows that he's going to need some level of coverage. So James is going to require an ACA coverage plan that has a robust coverage features, because his existing conditions require him to see specialists. Okay. Now let's talk about the transitioners to independence, right? So I do have clients that are like recent college grads, or I may have their parents, and their parents have been covering them while they're in college. And I can only talk about, state of North Carolina. If you're in North Carolina and your child goes to a state college, it does in any school, they require you to have healthcare, right? So his parents have covered him, and he's now embarking on his professional journey. But you all know, like I know, sometimes that big job just isn't coming right away. It's coming, but he's right there in between. So as he starts his career, he's trying to navigate. I'm running into the literacy of them understanding healthcare plans. Just imagine, we've helped our children. We've taken them to dental appointments. We've taken them to the doctor visits. We've done most of it up until the day that they graduate from high school, college. And so now that it's time for him to navigate on his own, that's where taking a look at what his needs are, he too could qualify for an affordable health care plan. So let's talk about why. What are some of the common medical events? And this is where I will tell people, you might hear me say that, health insurance is a financial literacy component. That's number one. There is no wealth care if you do not have the adequate health care. So let's take a look. What I do is also help individuals understand their coverage, understand when they go, what's actually on the plan that they can use. So let's start here real quick. So this is if you wanted to visit your healthcare provider's office. You get to see how much is it going to be from my primary care physician. In this case, this particular client has a plan that gives them both in network and out of network. What does that mean? That means that there are systems in the city that you live in as far as hospitals and doctors, and you want to make sure that your plan is going to cover it. And this is why it's so important to go over your summary of benefits, which is something that I make sure that I do with the client so that they're able to confidently utilize their plan. So in this case, this person going to the doctor, they're going to pay a $35 copay. All right. But now if that person, once they go to the doctor and the doctor says, look, you have to go to an orthopedic doctor because, you broke your toe. Right. So now they're going to have to exercise using their specialist benefits. Okay. Well, orthopedic doctor falls under a specialty. And so that copay is going to be $50 for that visit. Anything that is a preventative visit will be covered under the Affordable Health Care Plan at 100%. Now, also, you can have a pre-existing conditions. These are some of the laws that were put in place when the Affordable Health Care Plans by President Obama was established. You can have a pre-existing condition, and there are no limited lifetime limits. Back in the day, some of these healthcare plans would limit you at a dollar amount. There's no limit, okay? And the reason why that's important is, use the example of cancer. Cancer could, take out a poor man, a rich man, anyone. You understand? As far as their finances is concerned. And back in the day, those policies, and there's still some out there, the policy limit for the healthcare plan might have been $2 million. But a person that may experience cancer may go beyond 2 million or 1 million, whatever the limits were for those plans. And guess what? They're going to pay for everything out of pocket. You don't know how long that type of event may go on. So I just wanted to make sure that I covered that part. But getting back to the summary of benefits, if you have a test done, you go into the doctor's office, you pay your $35 copay. The doctor says, look, we're going to take some blood work. That's what's considered to be a diagnostic test. And then they're like, well, with the blood work, we're also going to do some imaging. We're going to take some x-ray. So now if you have a test, you want to look on your healthcare plan and see how much of that is going to be a cost to you. So in this case, getting blood work done in an x-ray is going to be $10. That's a $10 copay. If they were to get a CT, a PET scan, or MRI, their copay would be $50. So now they're done with the doctor's office. They're like, okay, we're going to send a prescription in for you. So in the event, because now we're just talking about common events that are going to occur when you may go to the doctor's office. So if you need drugs to treat your illness or condition, there are drug coverages here, and I do take the time to look up prescriptions so that we can confirm, according to the plan that you have, what tier, because drug coverages are in tier levels. And that's a whole nother, conversation and understanding. But to know that you understand your plan and know what prescriptions you currently have and to figure out what the cost may be for you on the front end is the most powerful thing that can happen. So there are tiers when it comes to drug coverage. Let's say if you have outpatient surgery, you're going to look on your plan and see, well, how much is that? It's $100 a day in this case. If you need immediate attention, in this case, going to the emergency room, going to being transported by ambulance or medical transportation would be 20% co-insurance. That means that you would pay 20% and the insurance company would pay the other portion, which would be 80% in this case. And then if you needed to have a visit to the urgent care department, then you on this plan would be paying $30 for that visit. And then it goes on to share at the very end of this. If you have a hospital stay, you go in there for one thing, next thing you know, they're keeping you. This shares with you as well what that looks like for your hospital stay. So now we've covered like the most common events. Now let's take a look at what the plan covers and what do you pay. I use some terms there, but I use some terms in the earlier slide. At the end of the day, these terms are going to be very, very key because your plans are going to have a monthly premium, which is what you pay monthly. But then to have an understanding about a medical deductible is going to be important. And I like to tell clients to think about their deductible when it comes to their vehicle. That means that if you were to have an accident and you wanted to use your automobile insurance coverage and you have a deductible, well, you would have to pay that deductible first and then the rest would be paid, right? So in this case, there are what you call overall deductibles on the healthcare plan. And in this example, the deductible is $500. So that just lets you know that going back here to the other screen, if there's anything that you're paying out of your pocket, it's going to either go towards your deductible or your co-pays are going to go to the deductible. And it tells you over here to the side, generally, you must pay all of the costs from providers up to the deductible amount before the plan begins to pay. Okay. Now, are there any services that are going to be covered before the deductible? Yes. In this instance, all of your preventative care and your primary care services are covered before you hit your deductible. That's important to know. Are there other deductibles for specific services? In this case, yes. So there is what's called a prescription drug coverage deductible. That's important to know because even though you have the drug coverage, there's a deductible that you have to meet first before that coverage actually kicks in. What is the out-of-pocket limit for a plan? And sometimes this can be very confusing, but like I tell my clients, listen, I will repeat it. I'll say it. I'll try to break it down as many times as it takes to have this understanding. But on every healthcare plan that exists, there is what's called an out-of-pocket limit. That means that you have a limit as to how much you will pay out of your pocket in a year, because healthcare plans are 1-year contracts. It's a health insurance contract between you and the healthcare provider. So you have a total out-of-pocket maximum. In this case, when the client goes to network providers, the total that they'll have to pay out of their pocket for the year would be $2,500. Okay. And if you meet that, in most cases, for the rest of the year, your services will be covered at 100%. What's not included in the out-of-pocket? In this case, it clearly, that's why I said, let me, kind of go through this. Co-payments for certain services are not covered. Premiums, any balance billing charges, they're not covered and they don't go towards the out-of-pocket expense. Will you pay less if you use a network provider? I hit that already. Yes, you will always pay less going to a network provider, because a lot of times those network providers have a what is the word I'm looking for? They have negotiated pricing with the health insurance companies. Okay, those providers have a negotiated pricing with the providers. So, do you need a referral? You need to look at your plan to see if you do or you don't, right? So, a lot of in the weeds type of information, but I felt it necessary to let you know and see what I actually do. And it's very important in my opinion. I'm very passionate about it because I have actually used the plans, and I'm able to help get people covered. And that's community work to me. That right there is helping people, not just in their current situation, but even with their families. So getting covered. Let's get covered. Let's get covered. Let's get covered. So there's some other available plans out there that I do help with. And the next major type of plan are Medicare plans. And, this is something to look at in terms of, let's say you are deemed disabled before age 65, and you have a waiting period of like 24 months before your Medicare kicks in, and you need coverage. Obamacare is there. Affordable health care is there to be able to assist in that manner. And guess what? As your agent, from that time to the time that you're going to qualify for Medicare, I can also assist you with that transition as well. Dental plans, I offer vision plans, short-term medical plans. There are other plans that are available and out there for different reasons that people may want them. And it's usually uncovered when I have the consultation with the client to see what are their needs. It's like a needs analysis that I'm doing, right? Some other areas to think about, you can purchase independent coverage. Sometimes you'll hear it called like supplemental coverage or ancillary coverage, or if you're one that has worked in corporate America or worked at a job and you have these additional benefits, these are in addition to coverages that will pay you directly should you be diagnosed with cancer. And the reason why that's important, because you have your medical insurance, which is what I just went over, but should something occur where you are diagnosed with cancer, these policies help with the time needed to really reflect on it. You're going to need some time off. You're going to need the time off for traveling back and forth, to the time that you're going to need off from work. So the cancer policies are very good to have if you know that your family is a family that experiences cancer. It can be, there's a plethora of different cancers, but if you know that the history of your family it has a cancer history, then having this alongside your major medical coverage would be a safeguard for you. Now, we don't want you to have cancer, right? So in our conversation, we'll talk about how to use your medical plan to use it for preventative measures more so than reacting when something's already occurring, right? All right, so heart attack, stroke, same thing. Do you have a family history of heart attacks? Do you have a family history of, blood pressure, diabetes, people that have experienced strokes and things of that nature? It's the same concept, these coverages. And I do have a plan that covers all three, but they're available to you to be able to have because of the care needed after being diagnosed and actually during going through any type of treatment or recovery. That's what we might call a supplemental or ancillary plan will do. Then you have your life insurance. I have gotten to the place where life insurance really should be called health insurance, because these life insurance plans have what we call living benefits that you're able to utilize for situations where you have a critical, chronic, or a cancer exposure. And so looking at life insurance a little differently these days is worth taking a look at. I still offer whole life and also final expenses, meaning, you just want some end of life policy to make sure that you're not leaving a burden on your family members or anyone else that may have to take care of your affairs. It's also called burial insurance. Okay, so I wanted to make sure that I went through and shared with you what all I offer to you, right? So what do you do? What can you do? What you can do is you can get signed up on my email list. You may not have anything that you want to talk about right now, but because you took a look at this and you could think about people that may need these services, and you may say, Shanae, look, I need you to talk to this person. And you know what, guys, please excuse my website address. I have to put the correct website in there. I have a C in there. It's ShanaeStarnesAgency.com. Okay. And yeah, so contact me, fill out your name, your phone number, go to that website, and then you're going to click on contact us. And when that form comes up, you're going to fill in your information, put a note there if you want me to give you a call now, or you want me to give you a call in the future. That's what I'm here to do. That's what I'm here to do. And let's see here. Okay, and that's about all, isn't it? So I wanted to capture this within a 30-minute time. We have reached that expectation. Again, thank you. This has all been a part of the Ask Dion Challenge, and this is day 4, and I am excited to have been able to share this with you. And so we're going to leave with my song of the day. Here we go.
We on an ultralight beam. We on an ultralight beam. This is a God dream. This is a God dream. Yeah. Every day. I'm just trying to keep my faith. What I'm looking for.